Hello, my name is Monti Khatod. I'm a member of the Southern California Permanente Medical Group, and I'm speaking to you from Kaiser in West Los Angeles. I want to speak to you about my JBJS article titled Dual Mobility Articulations in Revision Total Hip Arthroplasty. I think we all realize that revision surgery is becoming more common in our arthroplasty practice, and there is somewhat of a dearth of literature on implant factors associated with outcomes, and that was the motivation for me to query our joint replacement registry, which we're really lucky to have. And basically, one of the things we wanted to look at was there's an increased use of dual mobility that we're seeing in our own institution, and wanted to find out if that was effectively changing the outcomes for our patients undergoing revision surgery. Interestingly, we did find that we had reduced rates of aseptic revision and reduced rates of instability. We did some further analysis looking into these revision cases, and we found that these differences held up for patients who underwent revision surgery for the diagnosis of instability. And even furthermore, when we isolated patients that only had a headliner exchange, the use of dual mobility also reduced aseptic revisions and instability. We did compare these patients with small femoral heads, less than 36 millimeters, greater than 36 millimeters, and constrained liners on cross-linked polyethylene alone. Our follow-up was decent. However, the vast majority of our dual mobility cases was done between 2018 and 2022. And I think we still need to go for longer term follow-up to see if the thinness of the poly will hold up for aseptic revision. I think one of the things that we can use to change our practice is not being afraid to use dual mobility in these cases, and also especially when we're looking at smaller acetabular components that restrict our femoral head size in revision cases, going to a dual mobility. And I think somewhere in that 36 millimeter to 40 millimeter range, if you can get a femoral head of that size or larger, then you're good to go, but also consider dual mobility as an option in those unique cases.